Good evening, judges. We are Team 3 Pharmers, and we are privileged to have this opportunity to present to the judges our findings and recommendations for Cybertron Pharma's exploration of the APAC market for their products. So in the way that we have approached this study, we explore three key issues. First, which are the countries that will focus in Asia Pacific, and we'll be focusing on Indonesia and Thailand for our case study. Secondly, in the countries that we have chosen, we have decided also to focus on diabetes, oncology, and pediatrics as the key therapeutic areas for our products. And so, of these specific countries and therapeutic areas that we have chosen, we have also come up with certain growth strategies, including telepharmacy and other health-related programs in order to push our products to these countries in order to meet the 5x revenue uplift that we need by 2026. So we have done analysis across all the different countries that Cybertron Pharma is largely in. So we have explored Indonesia, Thailand, Malaysia, Vietnam, India, and Australia as in the Asia Pacific market. And we saw that Indonesia and Thailand were pretty attractive as a market to enter for three key reasons. So firstly, we thought that their competitive intensity is pretty manageable, given that they have quite few biosimilars, but they are still open to generics, such as what Cybertron Pharma offers in terms of its product offerings. And we thought that the regulatory requirements were also manageable, given that it is one of the lowest timelines in terms of time to approval for generics at 4 to 6 months. And lastly, we saw that insurance coverage is pretty high due to the public health insurance policies implemented by the government in Indonesia and Thailand. So therefore, we thought that it is strategic to target these two areas, given that they also have certain rural areas that are underserved as well, that we can target for our growth strategies.
Speaking a bit about Thailand's healthcare market. So the demographic notably is quite young, but we know that a notable part of the population is slowly moving to the elderly population segment. So that translates to more osteoporosis cases, which lends itself straight to calcium supplements, which is one of the products that we'll be focusing on. Other disease cases that are notably high is diabetes and cancer, which is a notable patient pool. So that will lend itself to some of our products better. For the distribution of healthcare in Thailand, a lot of it is outsourced, and a lot of it is reliant on e-commerce, which is a new trend, especially for over-the-counter and consumer health products. So we are factoring this in as well to later how we enter the market. For Thailand as well, the young population lends itself well to digital health trends. So telemedicine is definitely a trend and something that we'll be leveraging on, especially for low-risk treatments and low-risk products such as calcium supplements. And the health insurance coverage notably is more generic and more general in application. So that means there's space for more specific kinds of insurance that later we'll be talking about. Next. For Indonesia's healthcare market, the big population means the market is huge. And although the elderly population is still small, but it's starting to increase. And that means that disease cases of osteoporosis are starting to become increasingly common. And that lends itself to some of our products. For cancer and diabetes, similar to Thailand, there's also a notable patient pool. And so I try to identify the market barriers to entry. In Indonesia, the government is requiring large pharmaceutical companies to come in, not just to sell, but you want to take part in their tenders and as well as opportunities in the market. Government requires for companies to have provide value in terms of manufacturing and distribution employment opportunities. So we think that in order to get in on some opportunities, we likely need to partner existing companies already in this space who have already made networks within Indonesia. Regards to competitors, there's biosimilar and generics already in the product offerings that we are competing in product offerings that we're offering. But that also means that there's opportunity and acceptance towards biosimilars and generics in this space. And lastly, on the demand growth for dietary supplements, we see that a combination of COVID-19 and a lack of local health infrastructure has seen a rise in demand for self-medication as well as preventive care. So this lends itself to our calcium supplement strategy. So passing my time on.
Yep. So one way that Cybertron Pharma can leverage on in both spheres in Thailand and Indonesia is through local telehealth companies, right, to allow access to affordable medicine for suburban and rural urban health populations. There is a specific use case for telepharma, in both these countries, as players such as Dr. Raksa and Along Doctor and Hello Duck are both already present. There are two main benefits if Cybertron Pharma were to adopt such an approach. Firstly, from a pre-sales and post-sales approach, these two benefits extend individually. On the pre-sales approach, patients have greater option to purchase products online as well as avoid the risk and hazards of venturing out. After the sales, they're also able to ensure that the needs are accurately met, through various questions and answers that are answered, as well as capture on the growing trend of millennials who are expecting similar service in the sphere of telepharma. But more importantly, how can Cybertron Pharma operationalize such a process? They can do so through batching of orders, some of which could help to reduce delivery costs to the tune of 50%, as well as utilizing location technology such as Google Maps to enable delivery to defined territories based on real-world constraints. Thanks.
Talking about some of the possible acquisition or business partnerships that we'll be exploring both in Indonesia and Thailand. For Indonesia, we've identified Century Healthcare as well as K24. Firstly, because these companies have already established presence, especially on the distribution front, and they're also involved in the whole value chain from manufacturing to distribution to the actual implementing of healthcare programs. So this lends itself to what I said earlier about regulation. So this fits in well, and we were likely to be able to gain access through these companies. Another thing to note is that their product offerings actually complement our calcium supplements as well as our insulin products well, because that's currently not part of their offerings. So that will also work well. Notably also for Century and K24, they're already on some telemedicine and e-commerce platforms. So by getting in with them, we're also getting in on these networks. For Thailand, it's rather similar. All the companies that we've mentioned, they also have established presence online on e-commerce. So by getting in with them, we'll be able to get onto these networks for better sales as well. Similar to Century and K24, Mega Life and Thai Nakorn both do not have any calcium supplement offerings, and their diabetes treatments are also not really developed. So this is possible space and for partnership that we can work with them on. And hence, we think these are appropriate for partnerships or acquisitions. Pass my time on.
So the last growth strategy that we will embark on is to implement an end-to-end health screening program with key stakeholders in various countries based on their national health priorities. So, for example, in Thailand, there are 4 key areas that we'll look at. First is the provision of medication, which will be done by Cybertron Pharma, which will provide insulin, blood glucose monitors, folic acid, and calcium supplements at discount to market price or based on patients' needs. And for the other areas, financial coverage, health workers, and government, they will provide the respective benefits that you can see in the slide. So in terms of how we'll roll out this program is we'll do a city-by-city rollout targeting tier 2 suburban areas in Thailand, for example, in Chiang Mai, Samut Sakhon, Surat Thani, and Chonburi. So we'll be targeting diseases based on the national health priorities such as diabetes and cardiovascular diseases and cancer for Thailand. And it's the same for Indonesia. We'll also target tier 2 suburban areas, but with different partners based on the local dynamics.
Right. So as to how the growth strategy should be fully implemented, we've split it up into 3 different phases by recommendations. Early in 2022, in both H1 and H2, we'll start with the initial phase of shortlisting the companies and discussions with telehealth companies, as well as coming up with a short list of target companies for acquisitions. And we also, for related to the health programs advocacy, open discussions with key stakeholders, as well as initiate health program designs with the other stakeholders. Once the initial round has already started, we can then move on to more advanced stages of discussion for each of the associated strategies. Next slide, please. Yep. So there are risks presented across the different recommendations, but by taking risk mitigation, we can bring the risks below the risk barrier. The first one is associated cannibalization of existing in-store sales. One way to overcome this would ensure that there's targeted segmentation, such that customers who purchase through telepharmas are different from those who purchase through in-stores. The second risk is reduction of opportunities to cross-sell customers who could potentially use other OTC drugs, such as checking out recommendation options when they log out on payments. I think with that, we've come to the end of the presentation. Thank you. Stop recording.